Hey everybody, this is Tyson.
And Logan.
And you're listening to Dad Bods and Beards podcast. It's a show that gives you a fresh look on being a father, a husband, and honestly, a man being in today's world.
For people who want to have a good time, laugh, and be uplifted, thanks for subscribing and listening. Now for the show.
What up, everyone? Welcome to Dad Bods and Beards. Today, it's Logan and I, but we have a special guest, Dr. Wyatt West. He's actually my physician. I go to him for everything. Not only does he take care of me, but he takes care of a lot of people. And the things that he is very good at is preventative care, medical weight loss, depression, anxiety, diabetes, and things of that nature. And so why don't you introduce yourself, Dr. West, and we'll go from there.
Yeah, well, it's good to be here with you guys. So I'm a board certified family doctor. I'm also a board certified obesity medicine doctor.
That's why I go see him all the time.
Yeah. I was waiting for that.
I'm kind of like one of those, the psychiatrists that went into psychiatry because he's just a little crazy. So I went into obesity medicine because I have a special interest in it because I struggle with it myself. So,
okay.
I've been in practice for about 10 years out of residency. I've practiced in a couple locations, but all of them in northern Utah. When I started out my practice, I was up in a little community called Morgan. I was the only doctor practicing in the county. So that was like a cool education and saw a lot of cool stuff and had interesting and unique experiences. And then I moved to more of a suburban area and that's where I met Tyson and the rest is history, really.
Yeah.
No,
lots of weird medical history.
Yeah, exactly.
So it's Wyatt. It's so weird to call you that, but he is like the first doctor I've ever experienced where it's like he would just talk to you like you were his friend, and like you could actually confide in him. Like you could actually tell him, hey, this is my problems. These are the problems I'm really having. Can you help me? And he'll look at you and like, no, nothing can help with that. But
that sounds like
no.
That reminds me of a story. So I had a family doctor growing up in Sacramento where I grew up. His name was Rahat Saeed. Literally this from birth until 18. He was a pediatrics doctor. And when I was 18, getting ready to phase out of his office, and I sit down, check up after a couple, I had been to him for a little while, and he just goes, "Logan, you're getting fat." I'm like, "Thanks, doc. Good to see you too." Like, it's like he's known me my whole life, and he just like gives it to you straight. Like,
let's not sugarcoat that.
No. So what we wanted to do, the reason we have Dr. West on is because we're starting a new periodic episode that we're going to sprinkle in a couple times a month called Ask an Expert, where we're going to bring on a different expert in different fields, which Dr. West, you're an expert probably in quite a few fields. So we'll probably have you on a couple times if you've got time. But we've got some ideas of talking to a finance guy, talking to marriage, family, counselors or therapists. And then I even have a couple of friends that I think would be good to have on the show. So you're kind of helping us kick off the very first Ask an Expert episode. And Tyson thought you'd be a great one to kick it off. And so I'm kind of excited. We've got a list of different questions and topics that we want to talk to you about, and we'll see where it goes.
Yeah, it'll be fun. Yeah. Hopefully I don't set the bar too high,
Yeah.
No, you will. You will. I like you're very
the next guy's like an expert in gummy worms.
Speaking of gummies, I'm eating my collagen.
Yeah, dude. Yeah. Okay. There's the first question. Can you overdose on collagen? Because like every episode, Tyson is just eating collagen gummies.
Not that I know of. There's no
legitimately. So right now, I go. You know this because we talk. I've done the 75 hard. I'm working out on a daily basis, and absolutely loved it. I think overall, I've almost lost 40 pounds since the beginning. And with that, though, Porter, my 15-year-old, he's 15, has started working out with me, and it's a lot of fun. But he is so into bro science. He is all about, I'm going to, I need to take Bucked Up, and I need to take all this supplements and this supplements. And the more I look into it, it's just like there's some good stuff to like in it, but as well as there's so much caffeine And
Oh,
so I know for me, after a certain amount, I don't like how I feel with caffeine. So with the youth as well as adults, what's like the normal caffeine range that's not going to hurt them, as well as maybe it's a little too much and you probably shouldn't do that?
Yeah, that's a good question. It probably, a lot of that depends on their body weight and other stuff. If they're kind of 100-pound lightweight, it'll be different than if they weigh 250 pounds, even at the same age.
Okay.
But I think the generally acceptable range is up to about 400 milligrams a day. Higher than that, and I think there can be some toxicities. A lot of caffeine, people get used to it, they get tolerant, and so if they're used to drinking 4 monsters a day, then they're going to do better than if they only drink caffeine occasionally. But we don't totally know all the effects of caffeine on a developing brain, and so trying not to overdo it is probably safer.
Mm-hmm.
There are a few case reports. I'm trying to think of the details. There was like a 14 or 15-year-old kid in Chicago a couple years ago that had drank a couple, some coffee and a couple energy drinks, and had an arrhythmia and died from
Yeah,
it.
I heard that.
That can happen. It's real rare. I think I saw some interesting thing that the number, so it detailed the most commonly consumed drinks
Mm-hmm.
in America, and it was like water, of course, milk, and energy drink.
I believe it.
Oh,
More
yeah.
than soda, more than coffee, more than tea, more than Gatorade. I mean, it was like the third. And so there's a lot of caffeine consumption, and obviously there's not people dropping left and right. So it's probably not horrific for you, but it can cause problems. Acid reflux. I think probably the biggest issue is just a rebound fatigue after it wears off. So if you talk to anybody, oh, I'm tired all the time. Well, how much caffeine do you intake? Well, they are taking in a lot, and that's probably part of the reason.
So I drink probably. Sorry.
No, you go.
Okay, I personally drink probably an energy drink a day. I stopped, I drink my gallon of water no matter what. I do that now, but I probably have an energy drink a day. And it ranges between 120 to 200 grams of that. And then, like right now, you can see I love Coke Zero. So after I drink my gallon, and I start drinking that too. So, but if chronic use, is there any, with me, I've been drinking sodas and stuff like that for past 10, 20 years, I swear, since 19, when I went to Guatemala and they didn't have water, they just had Coke. You know what I mean?
Yeah.
Is there anything that's going to cause chronic issues later because you've been using it so long?
Not that I really know of. Acid reflux would probably be the biggest thing. Caffeine, it relaxes the little sphincter that closes off the stomach from the esophagus, and so people who drink a lot of caffeine get more reflux. But
that's interesting because I've had like really bad acid reflux for as long as I can remember. My brother has it too,
and constipation.
Well, that's only because of my protein intake. I got some Metamucil. We're working it into the regular diet. Everything's flowing. We're great. It was flowing for a minute. Now we're back there. But so I mean, it was like waking me up in the middle of the night, thinking I've had a heart attack, like that. But I mean, I was also pounding like 2 of the big cans of Red Bull in a day. Like not the little shorty ones, not the mid size. I think they were like, what are they, like 24-ounce cans, something big.
I have no idea.
And since we started 75 hard, I actually cut out Red Bull because I watched some late night YouTube down the rabbit hole of like, not just the caffeine, but like everything else that exists inside like the mainstream energy drinks. And I was a big soda drinker, but since we've been on 75 hard, I gave up soda and I'd already given up energy drinks. And so I might have like a Diet Dr. Pepper like a day, like a can. like with my dinner. And now that after you said that, like I can't like vividly remember the last time I had like super bad acid reflux, because I haven't been taking in near as much caffeine in the last, 2.5, almost 3 months now, Tyson, that we've been doing this.
Mm-hmm.
So that's interesting. I don't know if maybe that's correlated, or I'm just, like I'm a hypochondriac and I'm just like self-diagnosing. But
Yeah, I mean, it's certainly possible. It is a real thing.
yeah, but I do take pre-workout, and that is a whole nother beast.
Yeah.
that like makes your body hot and everything itches, but you can lift a lot. So
That's all that matters.
Those are called rashes.
yeah, dude. Oh my gosh. Did I tell you the time I accidentally, like I was like on the phone and I'm like making my pre-workout, because I do a scoop of pre-workout, a scoop of creatine, and then a scoop of like, now I do a scoop of like, I throw some Metamucil in there, shake it all up. I wasn't paying attention and I threw 2 scoops of the pre-workout in there. So we're talking like 600 milligrams of caffeine, and I didn't pay attention. I drank it. I'm like, wow, that was really strong. And then it dawned on me, and I was at the gym and I could like see sound, and I was like throwing weights across the room. Like it was an amazing workout, but I didn't sleep for like 3 hours after.
He ran a marathon.
Yeah. So yeah, that bucked up stuff, it can really get you. But
All right, so with me being an owner of a beard company, I'm all about like biotin. I'm with supplements like collagen, omegas, things like that. But are there certain things as from child to adulthood, things that we should be taking on a regular basis because it's just not found in our food, or things that we should be kind of more focused on just to maintain our health, so to speak?
Yeah. I think probably for most people, if they get a good, well-rounded, healthy diet, they probably are getting most everything that they need. A couple things that, we tend to not be outside as much as we once were. And then when we're outside, everybody wears sunscreen, which is a good thing for the most part. But vitamin D tends to, we can be deficient even from an infant. A breastfed infant can get deficient in vitamin D. So if you're going to supplement with something, that might be something you might consider. A good multivitamin.
So can sunscreen block like the intake of vitamin D from the sun?
I assume so. I assume it, less of the ultraviolet light that that turns vitamin, that activates vitamin D in the skin. It probably gets through. So I imagine that's true. I don't know. Yeah. I can't cite any studies on it.
Sure. Because like I work outside, and I'm like the definition of farmer's tan, and my wife is always like, put on sunscreen. Like, it's like, so I'm just asking so that I can go to my wife saying that, hey, Dr. West says I don't got to wear sunscreen, because then I get all the vitamin D that I need. So
it's true.
But I don't think she's going to accept it. She's
yeah. I heard one thing once. I'm trying to think of all the details exactly, but they were saying that if you went outside in a bathing suit, so you're exposing most of your body to the sun, in about 30 minutes, you would make around 15,000 units of vitamin D. I want to say that's the number.
Interesting.
Don't quote me on it, but anyway, you can get a lot of sun in a short amount of time. You can also get a lot of skin cancer with too long of.
Sure, that's
so it's a balance,
Speaking of which, I have a mole that you need to check.
Okay, let's do it.
It's on my butt.
Not a lot of sun exposure there usually.
No,
but I don't judge.
So what about like the one a day men's like supplement, like vitamin supplement, things like that? Are those more commercial, or are they like, are they actually like beneficial? Like I mean I take one, but it's like I don't ever feel like I notice a difference. So
yeah, they're fine. If you get a little too much of something, usually you'll excrete it, and if you're deficient in something, like vitamin D, then even if it has a small amount of vitamin D in it, it won't be enough to replenish something you're deficient in. So you'd have to get blood tests to know that.
Sure.
But I actually tell a lot of men this as well. I think probably the best multivitamin is a prenatal vitamin. It has pretty much everything you need in there for men who are starting to get, some thinning on top of their head.
Don't judge. Don't judge.
Tyson.
I'm like, as my forehead is slowly moving up as we're talking.
That's one of the first things I tell them to start using. And it's not like it's not a miracle thing, but but their hair will thicken up, their nails grow faster.
Interesting.
That's interesting.
So I think it helps, just kind of in my experience.
I almost got slapped last night because I was joking with my wife. Like I grabbed her. My wife still takes prenatals, even though we're not planning on having a kid, and she has her women's one-a-days. And I joked that like, oh, I almost took. I think I actually took one of your prenatals, and I was like, maybe that's why I was a little emotional today. And she was like, she's like, you say that on social media, I'll get canceled.
Well, that's interesting. Okay, so there's another thing that it's you and I spoke about this before when it was just me asking questions about things. And so when you are eating healthy or you're changing the way you think about eating and stuff like that, like I haven't had sugar, like candy bars, cookies, things like that, seriously, for 4 months now. It's nuts, and I don't crave it, but I do like my diet soda. I love Coke Zeros and stuff like that. And so I've heard, and I know lots of guys who are listening have heard this as well, that if you drink diet soda, it still makes your stomach big. It still makes you crave sugar. It still makes you want all this kind of stuff. What are your thoughts on that? Does it hurt your diet? Does it hurt your body if you're consuming diet soda on a daily basis?
Yeah. So good question. That's a question that there's a lot of people with a lot of strong opinions on.
Yeah.
And what is true is harder to tease out. There are a couple things that I've seen that are pretty credible. One is that when you give artificial sweeteners, I think they did it specifically on aspartame, this one study that I'm thinking of. They tested people's insulin before and after, and about 10% of people had a rise in their insulin after a sugar, a sugar substitute. And so probably for 10% of people, at least, there is some, appetite or weight gain effect that they might get if they're drinking a diet soda. Just kind of in the news just recently, the World Health Organization came out and said that aspartame is a possible carcinogen. And that's based on a lot of research that's been done for a long time, actually, where if you give lab rats high amounts of aspartame specifically, that they tend to get certain tumors. I think there have been a couple implicated, some brain tumors, bladder tumors, and I want to say either leukemia or lymphoma. So most of that research is they demonstrated those increased levels of tumor or cancer developing in these rats after really like unreasonably high levels of exposure to aspartame. So we do know that aspartame will cross the placenta. So they started feeding these pregnant rats aspartame, and then followed the offspring, and they were feeding these rats basically their entire lifespan, about the equivalent amount that you would get if you were drinking 20 cans of soda a day.
Okay,
really their entire life, and they had a higher number of the test rats develop these tumors or cancers than the control rats who are not getting the aspartame exposure. And so that's why the World Health Organization said it's a possible carcinogen.
Mm-hmm.
So really, like, no one consumes aspartame on that sort of a level.
Sure.
And so,
Except
well,
Logan.
I mean, Diet Coke in Utah for all these moms, you know, maybe that's the problem with my kids. Their mother just from that Coke.
Yeah, it's the intrauterine exposure. Yeah.
I mean, we do buy the flat in this house, apparently.
That's what he sprinkles on his oatmeal, just aspartame.
Yeah, but it was pretty incredible amounts of exposure to these rats. And then the other interesting part about it is that they never showed an increased level of mortality with these rats.
Oh.
So even though they developed more tumors, they didn't die earlier than rats who didn't develop the tumors. And so what we can say is that aspartame is possibly a carcinogen if rats drink 20 cans of diet soda per day from the fetus on through their death. And so anyway,
maybe that's where
take
your
it for
skin
what it
tags
is,
came from, Tyson.
Yeah.
Maybe that's your skin tags, or just too much Coke Zero.
Yeah, maybe.
No, I honestly think it's my fat crease in my neck, and me twisting it back and forth, and it just rubs and it creates an extra little skin.
Maybe we'll cut some off. You can chew on them. If they're sweet, then we know.
Logan
just gave me a weird image. Yeah, we're friends, but we're not that good of friends. I'm not going to chew on your skin tags.
Sprinkle that on the oatmeal, right?
Yeah. What's the? Just got a hint of skin tag in this. Yeah, it's delicious.
So the next question I have is with sleep. So me personally,
what's that?
Exactly.
What's that? What was that? Sleep?
Yeah. With me personally, I'm getting between, I would say, at the most 3 to 5 hours a day. That's just what I get, just because work full time, and then I come and do Copper Johns the rest of the night, and I have to spend time with the family. And then Candace, I would say, my wife, she gets less than that. And so what point does, because everyone says, I can live off 3 hours of sleep, I can live off 6 hours of sleep. Well, I have to have 10 hours of sleep. Everyone is different. Is that true? Or do we all need something that's like, hey, you need at least this many hours or you're not going to be able to function? Or am I a space cadet just because I don't get a lot of sleep? Or is it because my mind is just being pulled too many directions? That really is always on my mind. So what is too much? Is there such thing as too much sleep? Is there too little sleep? Like tell me a little about sleep, man.
Okay. Well, levels of sleep that you're getting, psychosis, that induced psychosis. This explains a lot now. We know what's going on here.
So Logan is not a real person.
I'm just a figment of your imagination. Can you imagine me a little skinnier next time, please?
Yeah. No. So most people don't get enough sleep. I mean, most people I talk to, myself included, probably most people need somewhere between 6 and 9 hours of sleep. Probably average is like 7-ish.
Okay.
As far as adults, I guess, sleep needs change through your life, obviously, but yeah, being chronically sleep deprived is not good. Am
I chronically sleep deprived, or am I just?
Yeah, I think you are.
I'd say knowing for a fact.
I've only been doing it for like 3 years.
Yeah, that's it, huh?
But
yeah,
I tell you what, if you say, "Hey, Tyson, you're good to sleep," I would fall asleep in like 3 seconds.
Okay, yeah, just go ahead, take a nap. I'll start blabbering. And
well, it's literally what happened on our drive down to Vegas. Like, you're like sitting there, I'm like, dude, I'm driving. Like, I'm pulling a trailer. You're fine. Go to sleep. And you're like, oh, are you gone, just dead to the world. And then he wakes up like mid conversation, like, whoa, did I fall asleep? You're like, yeah, just go back to sleep. Close your big heavy eyes.
Really, we were in mid conversation and I fell asleep. I'm like, wait, did I say something?
Yeah. Good sleep lowers inflammation in the body. Cortisol levels drop. You've been talking about losing weight and stuff. If you are chronically sleep deprived, that's a lot harder to do. One of the most challenging set of people that I have to try and help them lose weight are people who work night shifts. Even if they're used to it, even if they say, oh, I've done this since I was 18 and I'm in my 40s and this is the way I live, they have a harder time. We have these hormones that ebb and flow based on the time of day, and you're supposed to be asleep at night. And so you can do a lot of good stuff for your body. And I think there's 4 or 5 elements of just being generally healthy. Having a good diet, exercising regularly, good stress control, and adequate sleep. Maybe 1 or 2 other things, dealing with, familial type stuff, like not like our families, but, like genetic, diseases and things that people have. Anyway, there are 4 or 5 things that probably are the pillars of good health and longevity and stuff. And sleep is one of them. And it's one that a lot of us don't get enough of. Now you said at the beginning, are there some people who need more and less? Absolutely. 100%. But I think you can be conditioned too, so I used to actually be a big sleeper. When I was like 17, 18, if I didn't have something going on, I'd go to bed at 9:00 at night and wake up at 6 or whatever. And then I went into medical school and residency and didn't sleep for days at a time, and after that, I'm a lot worse of a sleeper than I used to be. I get less sleep and I function okay, I think, but I always feel tired.
Can you change that? Like, can I catch up? So let's say eventually Copper Johns explodes. I get employees and all this. Can I catch up, or is that not a thing?
Yeah, 100%. Yeah, you can catch up. Now, so a lot of people will say, well, I catch up on a weekend. I don't think that really works personally.
Okay.
You can get sleep in on a Saturday and get a Sunday nap and feel better for a couple of days, but I don't think it reverses the damage that poor sleep does. But anyway, that being said, that's kind of my opinion.
Can it be like habitual? Like you were saying, it was kind of like building up like almost like a resilience to like lack of sleep, because I had a time period in my life where, or like a tolerance, right? So I had a time period in my life where I was undiagnosed bipolar and I was on massive amounts of Adderall because my doctor at the time thought I was just ADHD. So it's like the Adderall and the bipolar was like a horrible cocktail. And I was awake. Like I'd be awake for days. And then I kind of built this really bad habit of being a poor sleeper during that time, because same thing in high school. I played sports. I was a football player, all that stuff. And so I slept really hard when I did go to sleep. But it was kind of during that like early 20s that I developed this really bad relationship with sleep, to where now I don't, like I said, like I'll have the opportunity to go to bed earlier, but sometimes I just don't. Like I'm just up. Like it's like habitual that I, as long as I get about 4 hours, I'm okay.
Yeah, no, you're totally right. So sleep is physiologic, but it's also behavioral.
Sure.
And so we can train ourselves to get by on less sleep, and we function okay, but it's not healthy. It's just we're functioning fine. If you try to change a sleep habit, so a lot of people will be like, okay, I went to bed at the same time and I got up at the same time for like 3 days and it didn't change my insomnia. Well, it's more like 2, 3, 4 months of consistency. It's very behavioral, sleep. So we talk a lot about when we see somebody in the office for poor sleep and insomnia, we'll talk a lot about sleep hygiene. So there are a couple aspects of sleep hygiene, is what we call it, sleep hygiene, just good sleep habits. So going to bed at the same time, waking up at the same time, that's part of good sleep hygiene. Trying to avoid frequent naps. For some people, I think naps are good. For other people, it kind of ruins their sleep the next night. Trying to avoid things that are distracting and keep you awake. So some people say, oh, I can't sleep without the TV on. Well, you've trained yourself that way. It's so it's so much better just to have a dark. I mean, our caveman ancestors, they didn't have TVs on at night. It
They
was
didn't bring their own box fan to Vegas
yeah,
to put in their hotel room
for their
Tyson?
Wi-Fi's.
I have to have a box fan. I do. If I hear anyone breathing or myself breathe, it'll wake me right up.
Yeah.
Just get this mental picture of Tyson standing in the hotel lobby checking in, and he has a box with a box fan in it under his arm.
Yeah.
Like you're the only man that's big enough to hold a whole entire box fan under your arm like a book.
I'm not embarrassed of it either. Like
I know you're just
cannot sleep without a box fan.
You literally bought a brand new one just to bring with us. And it's just like
that reminds me. That reminds me of a funny story. So I went on a trip with some friends back in medical school. And one of the guys shows up and he's like, I know it's weird, but I can't sleep unless I wrap a towel around my head.
That is weird.
He literally took one of the towels out of the bathroom and wrapped it around his head, his eyes, like his nose up, and he couldn't sleep unless he wrapped a towel around his head. So
that's funny.
Try
my
that.
Sister does that.
I don't know. Maybe it works. Maybe.
my oldest sister has had this blanket. Mind you, she's your age, Tyson. She's like 43. She has had. You're not that old, buddy. You're okay.
She's like
so
old.
she's
like
only halfway. I said oldest, not my old sister. But no, she has a blanket that she's had since she was really young, and she has to cover her eyes with it. I don't know if she still has it, but the last time it got brought up just a couple years ago, she's like, oh yeah, I still use my blanket. And like with me, I have like a death grip pillow. Like I hug this pillow till it can't breathe every single night when I sleep for as long as I can remember. And my wife hates it. She's like, can you get rid of that? So, and I was like, no, I beat it into submission to the point where I like it. And it's like, don't touch it. It's mine.
Yeah. So there's all these habit things we do. As long as it's not distracting, if it's your death grip pillow or the towel around the head or whatever, it's probably fine. Your box fan's fine. But things that, radio, TV, they distract you. They kind of wake you up a little bit, partially, when things are going on, you'll sleep more poorly. Bright lights, there's a lot about bright lights, before bed, in the past, our caveman ancestors, it got dark at night and there weren't artificial lights. That I think ruins a lot of people's sleep. So avoiding bright lights and screens and things for half an hour before bed.
So like Angry Birds before bed
Angry Birds.
Like sitting there in the dark playing Angry Birds. Like, I don't know who does that, but
I don't know what you're talking about.
Yeah.
It's Crazy Dave.
Great Dave.
One of the other big things we see is, we all sit in bed and have our tablet or our phone and, play Angry Birds or watch movies or whatever. Or, back in, 50 years ago, they'd sit and read the magazine in bed or whatever. And the problem with that is we train our bodies that we train our brains, I should say, that when we're in bed, we're not just sleeping. And so doing other, like reading or whatever outside of your bed, but when you get into bed, you're going to sleep. And doing that consistently will help your brain know, okay, I'm in bed. It's time to sleep. It's not time to read. It's not time to watch HBO or whatever. It's time to go to sleep.
You know what I've noticed, and this is serious. So I like to play Toon Blast. It's stupid. And I just really enjoy it. I'll do that until I usually fall asleep. And so now if I ever play Toon Blast, let's say I'm at church or something, and I don't know, I'm listening, but I'm playing Toon Blast, I'll start to fall asleep.
It's like
because I think I've trained my brain that it makes me fall asleep.
It's like the bell in the tree.
So I can't play it.
Yeah. What? The same thing in college with PowerPoints,
Yeah.
The professor dimmed the lights, PowerPoint on, I'm out.
That's funny. So I was going to ask, is there like a science behind like super light sleeping? Cause like there's somebody that I've been talking to that was saying that they like are very anxious in their sleep, that they like wake up scared, like suddenly a lot in the night. If that like they said there was a name for it. I can't remember what it's called, but it was kind of like just like jerks awake and like, oh, what was that? Did you hear that? Like,
so
I can't remember what it's called.
Really light sleepers versus really heavy sleepers.
Yeah.
Yeah. It's a thing. I notice like the thing that I deal with mostly with that kind of stuff is like kids who are really, really heavy sleepers will have more bedwetting problems.
Logan, that's Logan. I mean, he'll text me at night like, it happened again.
This time it was number 2.
he has to wear adult diapers. I forgot to tell you.
So
memory foam beds are not a good idea if you're a bedwetter.
It's funny though, like basically every year I get a couple parents bringing their 12-year-old in or whatever, saying, hey, they've got to go to scout camp, or they're going to, some football camp or something, and they still wet the bed and they're scared to go because
I get that.
They wet the bed, and there are treatments for that. It's just because they're super deep sleepers and they don't wake up. As far as light sleepers, it probably just translates a lot to insomnia.
That's how my boy is. He's 5, and he keeps asking us like, oh, why do I have to wear diapers to bed still? Like, cause he's like, I'm a big boy now. It's like, cause buddy, you don't wake up when you gotta go pee. Like, it's like, we can only have so many mattress pads or mattress covers or waterproof this, like, until how come I can't just wear pull-ups? I'm like, cause you're not even waking up to go to the bathroom in the middle of the night, bud. So there's
one trick is you restrict water after a certain time at night. You make them pee a couple times before they go to bed. And then we did this with our kids when we were potty training, and we'd wake them up at like when we were going to bed around like 11 or 11:30, wake them up and they're like half asleep and make them pee and then put them back in. Often
that's a good idea.
My wife has been having us do that. So my kids have loft beds. So they have like the play area underneath their bed, and then they have a little ladder. So we try to like wake him up and have him climb himself down the ladder and then walk down the hall. But he's like bumbling and just like bumping into stuff.
Needless to say, he has a broken arm.
Yeah, he fell off the ladder and then peed on the floor. Just
So guys, there's people that will take sleeping medication. Like I can't even think of some of the sleeping medications out there, but what's that really popular one that everyone always talks about?
Melatonin.
The one you're thinking of?
No, what was that?
Prescription?
Yeah,
so like Ambien or
Ambien. That's it. So I've heard that if they take Ambien stuff, that really doesn't help you. It puts you to sleep, but it doesn't really help you get the sleep that you need. Is that true?
Yeah, it kind of messes up so there are different. You everybody's heard of REM sleep, right?
Uh-huh.
But there are different phases of sleep that if you do like a sleep study, they'll put it's like almost like an EKG on your head, and they can map your brain waves, and there are different phases of sleep, and we need to transition through those phases in a pattern in order to get good restful sleep. And that's probably why a lot of people who are light sleepers don't feel very rested. It's like people who don't feel rested often have sleep apnea, because every time they go into the deeper levels of sleep, they're going apneic, so their brain wakes them up just enough into those lighter levels of sleep so that they'll open up and breathe. And so you have to go through those phases of sleep to really feel rested, and those medications don't allow that. And so people don't feel rested, and then they have like weird, they call them parasomnias, where they'll get up and they'll go eat a bucket of ice cream in the middle of the night and drive a car and get in accidents and weird stuff like that. Yeah, there's weird stories that you hear once in a while from people. The kind of the crazy stuff is rare, but people will walk down the street in their underwear in the middle of the night, and they have no idea what they're doing.
I wish I could say that me eating a bucket of ice cream in the middle of the night was totally because of a medication, but and same thing, walking down the street in my underwear, all that same stuff. Like that was just on accident.
No, so my oldest,
and
he won't care because I've said this before, but he was sleepwalking. I didn't even think it was a real thing, but he was sleepwalking and he had to pee. So he went to my daughter's room and just started peeing, and it was on her face as she was sleeping, and she woke up screaming, and he had no idea what he was doing, and we'll never let that down. But holy cow, that was hilarious. It was sad. It was like, what are you doing at first, and now it's just hilarious.
Did you have asparagus? What is going on?
No, and it was a lot. Like she was drenched.
I'm just waiting for you to text me and be like, after this episode, and like, Candace is so mad that I said that on the podcast. Oh,
But
that's good.
you were talking about how there's things that we can take care of, and then there's things that part of genetics and that we have to maybe take care of medically or go to therapy or something like that. When I'm talking is kind of like depression and anxiety and things like that. And I've told everyone before, and I've told you, I've been going to therapy, and it really does help me. It helps me kind of find, they ask the right questions. It helps me understand why I'm feeling this way. And, you know, and I've got this anxious and this type of, because of how busy I am and what I have to get accomplished. And I always feel like the pressure's on me. Sorry?
Not sleeping.
Yeah. And so, but with my family and all that kind of stuff, there's a lot of anxiety and a lot of depression. And when is it time for someone to actually say, okay, it's time? Like they might say therapy is not for them, but it's time for them to take care of it. When is that time? When is that time to say, hey, I need to go see Dr. Wyatt West and I need some medication, or I need to figure out what's going on in my life because I am miserable. I don't know what's going on and I hate it. Because I did that once before, if you remember, and come to find out I had low testosterone. It was just testosterone, and that was a problem.
And now you have sensitive nipples.
You missed this. So remember how you just prescribed testosterone to me, right?
Yeah.
So I don't know what was going on, but when we went to Vegas, I'm like, Logan, my nipples are so tender right now. And he's like, and so Logan just kept touching and poking and prodding at it and pinching him. I'm like, stop it.
I mean, you're basically asking for it. Like now it's become a whole thing. Like I made a TikTok out of it. Like we're
no, but
that's a great question.
The sun was up. But when is it time for someone to come in and say, I need help?
Yeah, that's a good question. So sometimes your therapist will tell you, they'll say, we're doing all this stuff and it's just not working. Like most everything, it's kind of like, when should I go take care of my knee pain? When is my acne?
Facts.
Yeah. When do I need a medicine for acne? When do I, there's so many things in our life that when we can't cope with them anymore, when the things that we're doing are not working, or when they're seriously impacting our function, then it's time, right? So I would say kind of a blanket statement. If you're having serious suicidal thoughts, you probably need to be talking to, some sort of medical practitioner, whether it's your family doctor, whether it's pediatrician, whether it's a psychiatrist. I think that's a pretty clear-cut thing because, obviously people who commit suicide or try to commit suicide, that has huge repercussions. I think if it's affecting your job, if you're missing days at work because you can't get out of bed, if it's affecting your relationships with your family, you're always irritable. People don't want to be around you. I think all of those things would really warrant a serious consideration to at least think about a medication. The medications aren't perfect; they have a lot of side effects. They don't work for everybody, but so I think I want to say statistically, a placebo, anything will work about 30% of the time. Therapy works about 40% of the time. A medicine works about 50% of the time. But often a combination of medication and therapy is your best bet at getting your mental illness into a remission state where it's not impacting you anymore. These things wax and wane through our lives. And so at different times they're worse, at different times they're better. One of the big things I see people do, kind of the big pitfalls, is they will start on a medication and 2 or 3 months later they feel better, but they're not it's because of the medicine. It's not because they are better. And so then they stop it and they spiral again. And so giving it enough time, if you do get on a medicine, I think 6 months is probably the minimum for most people. But for a lot of people, 1 to 2 years, for some people forever. It's really individual. But that's what I would say. If it's really significantly impacting the important parts of your life, if you're having any sort of suicidal or homicidal thoughts that are serious at all, all of those things would be, you need to seek help.
So with most medications and like we were talking about caffeine and stuff, you can build a tolerance to it. And so with like depression medication, anxiety medication, can you build a tolerance to that or you have to, your body gets used to something, so you have to go back and take something else? Does that happen?
Yeah. So it depends on the type for sure. Certain anxiety medicines that are called benzodiazepines, so like Xanax, Ativan, Valium, those are some common ones. Those medications you certainly can build tolerance to and dependence on. The other ones, so things like we call them SSRIs or SNRIs, like Prozac, Zoloft, Paxil, Cymbalta, stuff like that. I don't know that you technically develop a tolerance or even a dependence. I think it's different. But I do think sometimes something will have worked for a couple years, even a couple decades, and then kind of stop. And I've seen that often enough. I don't know why that happens. I don't know that anybody knows, but probably somebody knows. It's just not me. But certainly on occasion, we have to switch somebody from one to a different one.
Mm-hmm.
And often what I see is somebody will be like, boy, I just feel terrible. I've taken my 30 milligrams of Cymbalta for 15 years. It's been just fine all this time, but I just don't feel good. And we'll switch to one, and then we'll switch to a different one. And then 3 or 4 months later, we find out nothing's working. We're like, let's just go back to the original Cymbalta. And all of a sudden it works again. I can't explain why that happens, but I've seen it often enough that I know it does. And it's a real thing.
Interesting.
Well, it's one thing that I found in like my battle, like we keep saying that we're going to have like a whole episode on like mental health because it's so prevalent with men, right?
Sure.
And we should probably have you back for that one just to get like the expert side of it. With my whole journey of like realizing there was an issue and then seeking help for like my bipolar and just the long road to get me to where I'm stable and feel good and progressing and stuff like that, is one thing that I realized is just how insanely capable of amazingly positive and negative things that the human brain is capable of. Like the things that my brain was able to project that I was experiencing as real situations, but were only real to me, like just with like the mania and the crazy depression and like hallucinating and things like that. And then one thing that I heard a long time ago on a podcast I used to listen to all the time was mental health is not your fault, but it is your responsibility, because the only person who can help you the most in that situation is yourself, because you can only intervention somebody so many times, but if they're not willing to work on themselves or work on the issue themselves, like you're kicking against the bricks. So for me, it was looking at the statistics of okay, 95% of marriages with a bipolar spouse end in divorce. Children of a bipolar father have these types of traumas in their life. So for me, it was determined of like, I am not going to be on that side of the percentage. I want to be on the other side. So I've been through, gosh, I don't know how many different medications and different treatments, whether they're, some are this approved, some are not that approved, some are insurance approved, some are out of pocket, and finding that balance is a constant battle. Like you said, it waxes and wanes. Sometimes I'm great, and then sometimes like my wife almost could like predict a cycle when I wasn't doing good. So like my advice always is just you gotta go like you were saying, Dr. West. Like if you are cognitively aware that something is off, go talk to someone. Like it's that simple. Like it's not, guys nowadays are trying to be tougher than we need to be. Like why suffer if you can get some help? Like that's kind of like my motto or mantra. I don't know what you want to call it, but my life has been astronomically better since taking care of myself, because I'm able to take care of my family when I've taken care of myself.
Yeah. Well, I mean, you said that it's amazing what our brains can do. And I mean, we experience our whole life and our whole world and everything through our brain. And if something's not working, it changes the whole way we experience, mortality.
Mm-hmm.
Yeah, absolutely.
I've had. Oh, sorry.
Go ahead. Yeah.
No, I've had people in my life where they've actually harmed themselves to the point where they were trying to kill themselves. And you talk to people and everything like that, and you realize that they're in so much pain mentally and emotionally that they would rather feel the physical pain and go through that than to suffer any longer. And so it's a real thing. I've seen it firsthand. I've felt depression. I felt anxiety. And panic attacks where you're just like, what is this? And you actually personally, helped me and just told, those are panic attacks, Tyson. You know what I mean? Like, you helped me because I didn't know what they were, because it was like, I don't know what's going on. I feel this and I don't know what caused it. So it is a serious issue, and that's why I wanted to bring it up, just because, with all this stuff, we're talking about men's health and all that. It's just like, there does come a point in time where it's going to mess up your marriage. It's going to mess up your life. It's going to mess up your work. And just like me, that took me how long to go get knee replacement surgery?
Yeah.
Like literally my knee has been messed up forever. And he would put some medicine in it. We would do all this kind of stuff. And finally, like, dude, it's just time. And it was years, multiple years.
I think a lot of it is taboo when it comes to mental health in general. Then you throw in the whole men's aspect of it, because obviously we know that the majority of suicides are, in the United States are men, right?
Mm-hmm.
And one thing that was said to me when it was becoming very apparent to people in my life that, like, hey, Logan, something's wrong, was someone said to me, like, it's okay for, and like, this is maybe just more layman's terms, whatever. He's like, it's okay for your brain to be sick. Like, you don't need to feel guilty about this. You don't need to feel less than. You don't need to feel weak. Like it's a chemical imbalance. Like, it's not your fault. I mean, whether that's brought on by trauma or whether it's brought on by situational or seasonal or whatever, or it's genetic, then like there should be no guilt, no shame, no, I mean, those are natural human emotions. We're going to feel it. But once I got over like what I stood to lose by staying in that same stagnant / maybe like decreasing state of just a quality of life versus like, hey, this is going to be a long, hard road, but like I need to either, do this or I'm going to lose everything I have, or it's just going to get worse. So that's, like I said, kind of going back to what I was saying, like, if anybody who's listening to this, like if this is the, the thing you need to hear, like call your doctor. Like it's worth it. Whether it's your family doctor, call a psychiatrist, call a therapist, whoever. Like the hardest step is that first phone call. And then, however hard that road is, you're going to look back and just be like, man, I'm so glad I did that, because who knows, how worse off I could have been without it.
Yeah. Yeah. I think some of the stigma, brains have to do with behavior, right? And so we're supposed to be able to control our behavior, quote unquote, right? And if your brain is sick, forever, that was your fault, right? But nobody was like, hey, he's got pancreatic cancer.
Yeah.
What a failure,
Yeah, exactly. Yeah. Or like, oh, just suck it up.
Exactly. Yeah. It's all in your head. Right. And so our brain is an organ, just like our liver or our pancreas. It's just exceedingly more complicated. And so we don't understand it all, but I mean, sometimes people will come in and talk to me and they'll be like, hey, they feel like such a failure. And that's actually part of depression, right? That's one of the symptoms of depression, is you feel like you're a failure and you've let your family down, you let yourself down, you've, whatever. And guiltiness and all those things. Those are some of the classic symptoms. anyway, I'll just tell them, I'll say, hey, look, or they feel like they're a failure, and then they feel like, all is lost. I've got, depression or whatever. And I'm like, hey, this is actually treatable. This is a treatable condition. There are a lot of diseases that are not treatable. I mean, we could be sitting down and saying, you've got lupus, and that the treatment's harder, and the side effects of those medicines are worse. And so there are a lot of worse diagnoses. All right. So that's kind of the positive spin on it is, yeah, depression's terrible, anxiety's terrible, bipolar's terrible, but they are treatable. And
Interesting.
so, so it's, what a blessing, right? There are a lot of worse things.
Yeah, I guess you'd have to look at it that way of like you could be terminal, like you could have an inoperable, and there might be people listening to this that have those situations in which super sympathetic and feel terrible for, but like in this perspective of like, yeah, like if like as guys we naturally want to find solutions, like our our wife or a girlfriend or partner or whoever is like experiencing this, and they're like, what, how do I fix it? I don't want to deal with these emotions anymore. Like why the same should be true of like, why suffer through that if there is a way that you, even if it is a long road, like help, get some help find the solution. One of the biggest things that I ever did that helped me a lot was cognitive behavioral therapy. Was like sitting down with a licensed cognitive behavioral therapist that helped me literally, I kind of call it like the Shrek theory, like peel back the layers of the onion and find out like, why is this a bad habit? Where did I create it? How can I break it? Like, how can I, like peeling back all of those layers to find what part of Logan is broken here that needs to get fixed. And it's like, I still go back when I'm, even to this day of like times that, oh, that was a good exercise. Let me try that in this situation. And I was just telling Tyson earlier of something that happened today that really just sent me into this tailspin of frustration. And I just had to like kind of back off and get the emotions out. But my point in saying all this is guys internalize stuff way too much. And we just try to like keep it bottled up. Don't show it, I can fix it myself, or just, ignore it and it'll go away. Well, unfortunately, it doesn't. It gets worse. So yeah, I mean, get the help that you need. It's there. Like, why not fix what you can fix?
So let's be honest. You'll see, how many patients do you usually see on average a day?
In the 20s somewhere.
Okay.
Yeah.
And so you see these 20 patients a day. Do you ever judge them? No, I'm dead serious, because a lot of guys are afraid of being judged. A lot of people are afraid, like, oh, I know you judge me, but that's different. No, but like a lot of people are afraid of being judged, so they don't want to come in and like, oh, I have something, whatever, stupid. Oh, this is nothing. This is not a big deal. Like, you're not going to judge them. And you're going to care for them. That's what you do. This is what you love. And of course, I don't know, I'm speaking for you, but you don't judge them.
Yeah, no, it's I don't know. It's we're just here to help people, right?
Yeah.
And so whatever the problem is, if I can help you with it, that was one of the things that I liked the most about family medicine. When I went into medical school, that was not my plan to be a family doctor. And when I was on my family medicine rotation, I was like, holy cow, I'm seeing all these different type of people, and maybe I can't maybe I can't replace Tyson's knee, but I can do something to help him.
Yeah.
And maybe I can't do cognitive behavioral therapy and like a psychiatrist or a psychologist, but I can do something to help that person. And maybe I'm not as good as whatever for this old person, but I can do something to help basically every person that I see. And I think that was actually what made me do family medicine. And so whether I'm good at it or not is a different story, but I can do at least something to help everybody.
What I like about you is you're very personable. You really do listen, and you have a conversation. And I know you do that with everyone because
Did you
I
have to
told people about you. No, I've referred to people to you, and I'm like, you're going to love him. And then they come back and say, dude, he's legit. Like, he listens. I've never had a doctor like that before, and it's special. So I'm grateful that you're here. We're hitting that hour mark, and so it's usually the time where everyone's like, "Okay, I got to get to work." So if you were to say one, like, give advice to, on anything, and you have everyone's ears right now, what would you say? Just on anything.
On anything.
On anything.
That's a big question. Let's see.
It's a huge question.
Yeah, I would say, there's so many things that we do because we're supposed to, right? And we beat ourselves up over it if we don't. And and I see this with so many different conditions. I see it mostly with my weight loss clinic is, hey, look, don't do things just to lose weight. Don't do things because you're supposed to. Don't do stuff because other people think you should. Do things because you want to have more joy in your life. And let's say you go on a diet and you're eating good food and you're trying to get good sleep and you're exercising, and let's say you don't lose a single pound. Did you fail? No, you're having joy and you're becoming healthier, and so that should be more of our motivation than what we look like or what other people think we are. And I'm speaking to myself when I say that too, but I think we give other people too much power.
Ooh, I like that.
Yeah, I think people will say, I can't go to the gym because people are watching me.
100%.
No, they're not. They're not watching you. They're so self-conscious about themselves that they couldn't care less what you're doing.
Mm-hmm.
I don't go swimming because I don't want people to see me. Well, they're too self-conscious about themselves. Don't give them that power. If you want to go swimming, go swimming. If you want to go to the gym, go to the gym. If you want to do whatever, do it, because it's your life, and ultimately you're the one that cares the most about it.
That's great. I love that. Yeah, like, I mean, I can identify with all of that, because I mean, I even made a TikTok about like getting back into the gym after like 11 plus years and being like, everybody is like, everyone's looking at me, I'm fat and I'm sweaty and I can't lift anything like I used to. But now I'm feeling like I'm progressing there and in other places too. And it's kind of like, man, I don't know why I was beating myself up over this. Like, I enjoy going, I kind of look forward to it. I enjoy like the high of it. So I think I can apply that in a lot of different areas in my life of kind of like, stop worrying about what these people think, do what makes you happy, do what makes you, kind of progress, and just block out the haters.
So much easier said than done, though.
It is.
Yeah.
So,
especially when you're involved in social media, you get a lot of haters. People they're just naturally just rude.
What's funny is that stuff doesn't bother me. It's me projecting my insecurities on other people. So like, I'll say something with people in my life, like out in social media world and stuff like that. That doesn't bother me. I'm like, yeah, I know his beer is amazing. It's better than mine. That doesn't hurt my feelings. But it's when I am maybe saying Dr. West, I have a lot of respect for him, and all of a sudden I'll say something stupid. That night, I'll wake up in the middle of the night. I'm like, why the freak did I say that?
Cringe.
That's the stuff that drives me nuts.
Well, one thing with you, and I'm not beating you up here, like I say this to you all the time, like, stop apologizing. Like, you're not annoying me, you're not bugging me. Like, you're like, I'm sorry, I'm stupid. I'm like, no, you're not. Stop apologizing. Like, I'll tell you if I think you're stupid. That's because I love you. So
I've never said I'm stupid. Now that hurts my feelings.
No, well, I'm sure you have. But
well, I thought it.
Yeah. No, I think that's some great advice, because I think we're all capable of like the self-deprecating thoughts of just, I'm this, or everyone's looking at this. And so, yeah, I think if you could take away anything from all the different topics that we talked about, is like, just focus on yourself and your health, your mental health, your physical health, and just the happiness. And one thing I've been focusing on a lot, and this is freaking Robert's fault, is gratitude. Trying to find the things that I am grateful for when I really feel like punching something. So yeah, that's a drug in and of itself too.
And the one last thing with what you just said and it reminded me of is your spouse, your children, your work, everyone. No one is in charge of your happiness. You are.
Yeah.
And so if you're happy and you're focusing on yourself and you're creating that happiness, whether it be through spirituality, through physical, through emotional, whatever it may be that you're working on, when you're happy, you're going to project that and it's going to help your family. It's going to help your spouse. It's going to be all that because you can be that foundation for them as well. And they can be that for themselves and for you as well. So because we're not always going to have a great day. Some days we'll go and we're like, dude, I'm like at 30%. Like I don't want to be here right now. And that's going to happen. And hopefully, your wife can be that 70%. And then one day you can be that 70 and she be the 30. It's just how it works. And so you're happy and you continually support everyone and support yourself. That's just what I think.
Yeah. If you're happy and it, have sensitive nipples, right, Tyson? You always just got to end it on a stupid thought. Like I feel like if the episode's not ended with us
I'm actually touching my nipples as we speak because I'm like, they're not sensitive.
I'm really wanting. I told my wife, I was like, maybe I should go talk to my doctor about having low T. I was like, because of these and these reasons. I'm like, I could never tell Tyson if I was on it because he'd be like, payback time, and just start coming after me. But no, thanks so much for hopping on here, Dr. West. We're definitely gonna have to have you on more for just some other stuff. I don't know. Maybe he's like, never again. This was
this is great.
Too long, too much. But
it's been an honor. Like I said, I have an appointment with you on the 30th because you're like 2 months out.
It's like the reverse of the club. Like when you're younger, you can never get into the busy clubs versus when you're older, you're like, I can never get into the doctor. He's so popular.
I know. Everyone's like, wait, Dr. West checked your prostate. No, there was a story beforehand where I had a doctor check and it was really embarrassing. That's all we're going to leave it at that.
And we're going to end the episode talking about Tyson's prostate. Thanks for listening, everybody.
Thank you so much for listening, guys. It means the world to us. If you have a chance, please give us a 5-star review, as well as write something a little pretty in there so that we know that you know that we know that you care. Anyway, have a great day, guys. See, I can't do it.
Dude, that was good. I like that. You can't redo it without laughing. That was good.